We're now going to be using the SIBA top sheet with handles attached, which is actually a special order. It's not on our Mediquip standard stock catalogue, but we can use this top sheet to attach onto the spreader bar of a hoist. It could be ceiling track hoist, gantry hoist, or even mobile hoist. And so this top sheet is actually from the SIBA bed system, and the bottom sheet that we happen to have is from the Wendylett bed system, but both of them are compatible. Both of them have that satin material which slides against each other. And as mentioned in previous videos, if you're using any type of bed system, there needs to be a risk assessment and a moving handling plan, and you need to do your safety checks, checking that everything's intact and working well. There's no fraying or ripping of any of that material. So from here then we're going to unlock our sheets, and I will place another slide sheet underneath the feet, lower limb there, just to make sure that there's no shearing. And from here, we're just going to ask the patient to bend this knee, take this hand across and look towards me. And then at this point, because we're going to be doing a roll, I'm just going to move the pillow towards me a little bit, putting the slide sheet in between the head and the pillow, and just moving it a little bit towards me. There's enough space on that pillow to roll. And then from there, we're going to start bringing in that ceiling track hoist. So I'll just show you on my side then that we have these handles there that are built in to the slide sheet all the way along that slide sheet. As I said, it is a special order that you can buy in. And what we're going to do is, on that side of the bed, my colleague is going to attach 2 of these straps onto the spreader bar. The spreader bar needs to be in line with shoulders and hips so that those parts of the body are supported. On this occasion, we're going to give the patient the handset because it's good to encourage any kind of independence that we can. So you need to press the green button is down and the grey is up, and I'll let you know what to press when we're ready. So from here then we need to bring the spreader bar down. So if you could press that green button, thank you. And my colleague, once we're down low enough, we're going to attach the straps onto the spreader bar. That's good. Okay. And then if you're ready to go up, press that grey button. And what's going to happen as the spreader bar is lifting, it will encourage you to roll over towards me. So if you can just pause there. So we're going to have a little bit of a pause just to reassess the situation. The patient might be likely to roll towards me and maybe a bit too far towards the edge of the bed. So we're just going to reposition the patient back in that direction. So from the other side, my colleague is just there to support. And what I'm going to do is I'm just going to use some of the sheeting, and I'm just going to give a very gentle push of the patient just to get them back over towards the middle of the bed a bit more to keep them nice and safe. And then from there, can you go up a little bit more? Right, we're at the top, as you can see, so I'm now going to use the bed control. So rather than lifting at the hoist, I'm lowering the bed to finish off the roll. And we're both making sure, either side of the bed, that the patient's nice and safe. How does that feel? Do you feel like you're rolled? Yeah, so we just bring this foot forwards, if we can. And then if you can lower that spreader bar, so green button, and I'm just supporting here, and if we can grab the wedge from over there as well. I'm just going to put the wedge in place. Lovely. Great, and then lowering right down. That's probably as far as we can go, so we'll lift the bed up. And then we can undo our straps on the spreader bar. And we have the patient safely rolled onto their side. So that might be a useful technique to use to really minimise any risk of injury. If you wanted to carry out personal care or if it was just for repositioning, then that's a really good, nice and safe technique to use. Once we've moved our patient into a better, safer position in the bed, we need to make sure that we're locking off the sheets on every occasion, and we do this by folding back a nice big fold of the bottom of the sheet, like so, and then tucking in the sheet under the mattress, if possible. And by locking off the Wendylett sheets or the SIBA sheets, we're minimising the risk of any movement in bed and potential falling off the bed.